So hi, this video is about sports injury webinar. My topic is fracture clavicle. The shoulder is considered one of the largest joint in the body, formed by the articulation of the shoulder blade, which is scapula, and the bone of the upper arm humerus. The clavicle or collarbone is the prominent bone that attaches to the scapula and rib cage, providing to support the shoulder joint and it protecting important nerves that runs behind it. The collarbone or clavicle is a bone which located between shoulder and the sternum. The clavicle bone is divided into three main parts. First, medial end, which is the part closest to the sternum, and the second is midshaft, which is the middle of the clavicle and the most commonly fractured part, and the third is distal end, the part on the outside part of the clavicle. Fracture clavicle. The clavicle usually fracture with high energy dramatic impacts such as the car accident or during skateboard fall onto the floor or an outstretched arm. The clavicle fracture occurs in the middle of the bone, occasionally where it attached to the shoulder blade, which is scapula or rib cage. Clavicle fracture is very painful and makes it difficult to move your arm. Clavicle fracture repair surgeries uses plates and screws to fix severe clavicle fracture. Doctors may tell repair if broken into the bone are displaced or bone has broken through the skin open fracture or there are multiple fractures. Non-union or malunion bones which are clavicle does not heal or heals in the wrong position. Surgical procedure that clavicle fracture repairs is performed as the doctor or surgeon makes an incision in the line with or make a perpendicular to the clavicle bone. The fat and muscles layers are separated to expose the fractured clavicle. After that, the fractured bone is positioned back to its normal. To recover the surgeon, some of small plate in the position along with some pins also screws are drilled into the bone. Everything done. The surgeon used X-ray to ensure that screws and pins were placed in the right position. Then they make a search of the incision and then do a dressing. Treatment with physical therapy. Indication clavicle fracture may be treated with conservative, non-operative methods such as applying a sting or brace, and physical therapy to restore motion. Exercise to recover, which given physical therapy to getting back the function at the shoulder. First, they involve gently motion exercise. Second, strengthening exercise will help restore movement in your shoulder. After that, you will be able to back to regular activities after about 3 months. And these are some of the exercise you can you should follow after the surgery, like shoulder flexion, shoulder abduction, shoulder extension, side lying horizontal abduction, scapular activity range of motion, horizontal shoulder abduction, and resisted shoulder internal rotation, resisted shoulder extension, resisted shoulder external rotation, resisted shoulder flexion, single arm shoulder abduction, front shoulder extension. Avoid. Must follow some tips which you should avoid lifting heavy weights before the time of 3 months. After complete healing, you will be able to do your work daily.